So a lot of colleagues will ask me, since they understand that we do a lot of alloderm, pinhole technique, we use growth factors, and we use all these conservative methods in order to cover the roots of teeth that have suffered recession. They'll ask me if there's ever a time when I do use tissue from the roof of the mouth. And the answer is yes. Even though I would say 90% of the time we're using the more conservative methods to achieve the same results, I would say that the times that we go to the roof of the mouth for the donor tissue is when we're treating recession that takes place on the lingual, on the inside part of the root, because that tends to be a little bit more challenging. So for example, if it's lower front teeth, the tongue is right behind the area, there's a lot of moving tissue, and we just want something that's going to have a head start in terms of vascularity. So the connective tissue graft, which does come from the roof of the mouth, is ideal for a situation like that. Also, when we want to control thickness, so some people with a very high smile will demonstrate defects in areas where teeth have been missing for a long period of time. So some patients didn't get implants early on in their lives, and they ended up with bridges, like traditional fixed bridges, which is not the optimal choice, but it is what it is. So what we do is, in those areas, after all these years that the bone has actually started to atrophy, we can correct that by controlling the thickness of the autogenous graft, which comes from the roof of the mouth. So I hope that helps, and that's what we do.